Good evening, esteemed faculty members, speakers, and all the delegates. Thank you for joining. This is Sahiti on behalf of Shield Connect, welcoming you all for today's webinar, OGSSI Journal Club, organized by OGSSI Clinical Research Committee. It's my privilege to introduce the coordinators and chairpersons of today's webinar, Dr. Deepa Tangamani ma'am. Ma'am is the consultant at Apollo First Med Hospitals, Chennai, consultant Tamarai Fertility Solutions, Chennai, Joint Secretary of ATNR COG, Advisory Committee of OGSSI from 2023 to 24, Chairperson OGSSI 2024 Clinical Research and Quiz Committee. I welcome you, ma'am. It's my privilege to introduce Dr. Priya Kannappan, ma'am. Ma'am is the consultant obstetrician and fertility expert at Dr. Mehta's Hospital, Chetpet, Chennai, and Garbha Rakshanambigai Fertility Center, Chennai, Executive Committee member of OGSSI, Chennai. I welcome you, ma'am, and I hand over the session to the coordinators.
Thank you, Sagati. So, good evening, everyone. Welcome to our OBGYN OGSSI Journal Club meetings. Today, this is our first webinar of this OGSSI 2024 teams under Vijaya Madam leadership. So, we have today enriching sessions on two topics like how to enjoy doing thesis and manuscript, how to do a manuscript writing. There will be an exciting discussions following these two talks. I'm excited about that question answer session that lie ahead. All the questions has been curated by all our students who was into the group of CRC. And thank you for all for joining us. Before we go into our discussions, I would like to invite you all to join me in a brief moment to light the virtual lamp. This is a tradition in many cultures. As we illuminate this lamp, let us also ignite our minds with curiosity and openness to learn. Thank you. To welcome our gathering, I may invite Vijaya Madam. She's our current president of OGSSI and she holds a national and a state level master trainer positions in key areas such as safe delivery practices, emergency obstetrics and cervical cancer screening. Madam actively involved in public health initiatives, organized many programs, and she raised awareness about violence against women. She recognized for her contributions. She has received Best Doctor Award from the Honorable Health Minister of Tamil Nadu and the Best Paper Award of ACOG 2015. Madam's commitment to advancing medical knowledge is evident through her publications in various national and international journals, and her areas of interest is high-risk pregnancy, infertility, and laparoscopic surgeries. Madam, please give a welcome address, ma'am.
Hi all, good evening. This is our first research methodology committee by Deepa and Priya Kannappan after OGSSI 2024 has taken over. And we have a few committees in OGSSI. And this is one of the dry committee because everybody used to run away when it comes to research. But what makes it more interesting is the involvement with Deepa and Priya. When I went to FOXY managing committee meeting, they were asking about both of you. I was really surprised because the committee especially so much involved, and please don't take them out of that committee like that. I know students, the research is a very, very important part. Maybe in olden days, the marks and the subject and the clinical knowledge, that scores the university marks. But now the research, because we rely mostly on RCOG, ACOG and NICE guidelines. The Indian guidelines are very, very few because we don't have that much of, we don't understand what is research. Actually, if you understand the research, it is very, very easy. That is why National Medical Education and NMC has made it mandatory. You should all pass the basic research course before you pass out of the PG. You know that or not, I don't know. It is very, very mandatory to pass the basic research methodology examination. And also, it is all like Greek and Latin when you say meta-analysis, RCOT, RCT, and case control studies and case series. We don't understand any of this because the statistics plays a very, very important role. But unless our knowledge is empowered with evidences, we cannot go forward. So this is a very, very important committee meeting and webinar you should attend. Every month they'll be doing. They are inserting so many good things in between your inputs, your questions, and little more quiz to make it more interesting, not to be so dry. And also, all papers are selected, hand chosen by both of them. So I'm sure it will be benefited, and I'm sure. I want to be very, very frank. I'm first time attending this research methodology, though I have taken the research course in MMC and Ramachandra. But let's see how these people are doing it. And I'm really 100% sure you all will be benefited. Please, if they don't attend, you pass on to your friends. At least from next month onwards, the attendance should be at least 100, because it is all made like a cakewalk for you. Everything put on a plate and it is fed, spoon fed to you. You all please enjoy, and all the very best, Deepa and Priya.
Thank you, ma'am. Thank you, ma'am. So, Secretary Geeta Madam is yet to join. So, in the meantime, my co-chairpersons of Quiz Committee and CRC Committee, Dr. Priya Kannappan, she is a fertility specialist in Mehta Hospitals, as well as she is, as Madam says, she has passion about teaching and she's a voracious reader and passion about quiz and I mean, it's an amazing passion. It's infectious, actually, I can say. Over to Priya to deliver the Oxy prayer.
Thank you, Deepa Madam. Thank you, God. In humility we gather. In gratitude we pray for all the good things you have given us. Shower us with your blessings to pass on the healing touch, to celebrate the arrival of each new life and a mom reborn. The courage to deal with it all when things are not perfect, and to remember that we are but messengers to keep our women safe and free from sorrow. We bow before your kindness and the magnanimity of your endless love. So thank you, and thank you everyone for joining. We will be recording this session. We'll be sharing to you as well. And we'll be like giving you insights about the clinical research as well as on any academic help which you need. Every month we'll be having a quiz with the clinical research committee meeting, so that to make it interesting. And we will be like also announcing the quiz winners in the common groups as well. So kindly participate and kindly support us in this journey. Let us move together. Thank you, madam.
Thank you, Priyam. So we'll directly go into the sessions. Our first session is on how to enjoy doing a thesis. So I'm proud and it's my privilege to introduce EPSI Madam. Madam holds a degree. You just read about the degree. It will take time. MD, DGO, FRCOG, FICUG, ACME, FIMS, PhD, and DSc. That showcase her extensive expertise in the obstetrics and gynecology fields. I never seen DSc and PhD, Madam. I think you are the first person. With a background as a former superintendent of government Orasaram Hospital and past president of OGSSI, past president Chennai Menopause Society, she had an remarkable mark in the medical community. Her contribution to recognized with numerous awards, including the prestigious Lifetime Achievement Award from Tamil Nadu Medical MGR University, as well as FOXY. Madam's passion for education is evident. She is a PhD guide, and her dedication to conducting awareness program for medical staff, schools, and colleges. She also made a significant strides in research with numerous papers published in index journals. Madam is a reviewer for IFST. At the end, the most important is Madam is like she's into the technology. She developed most innovative apps like Midlife and Beyond and Pre-eclampsia precision model apps. And she also directed small short films and authoring textbooks. Her Green Book of OBGYN textbook is famous among most of the students. And her commitment to excellence and tireless efforts in advancing medical education is a true icon in the field, Madam. Thank you, ma'am. Please educate us how to start doing a thesis. Enjoy doing a thesis, ma'am.
Okay.
you are able to see
Ma'am,
my
screen
slide.
வரல madam. இல்ல madam.
1 minute. I'll just.
இன்னும் வரல madam.
Why it is showing this will stop other screen sharing? Do you
Yes,
want to
சொல்லி கொடுத்துடுங்க madam. You can give it as
Yes.
yes.
Yes,
madam.
we can
We
see
can-
now, ma'am.
Okay.
Slideshow mode.
Okay, at the outset, I congratulate these two youngsters, Dr. Deepa and Priya Kanappan, for the enthusiastic activity in research and the journal club. And I thank OGSSI, the president, Dr. Vijaya, the secretary, Dr. Geeta Lakshmi, for giving me an opportunity to share this. The topic is given to me is tips and tricks on how to enjoy doing dissertation. So this made me to ask so many questions, right? So when the topic given to me by Dr. Deepa, few questions came to my mind. What is meant by dissertation? How to choose the dissertation topic? How to make it interesting? What are all the skills involved in writing dissertation? How to have sustained interest in doing dissertation? What impact on the field by your dissertation? How to select a research question? How to structure a dissertation? What is ethical consideration? How to balance time management? What are all the possible outcome of your completed dissertation? These are all the few questions came. Am I audible?
Yes, ma'am.
Now you're audible, madam. Yes, madam.
So far it is not audible.
No, no, in
My God.
between 1 second, 1
Just had a
second.
small pause.
Okay. So coming to the definition, or what do you mean by dissertation? It is an extended piece of academic writing that is completed to obtain a degree, right? So unless you complete this dissertation, you are not going to get your degree. But it typically involves researching an area of study and presenting an original argument. You are going to do it, and it's supposed to be an original argument or a hypothesis, right? So the most students feel the very moment when they enter MD and the people call them and ask them to do dissertation, they feel that dissertation is the most pressurized assignment of a student's life. So this attitude will create a stress, resentful of topic you choose, even
Madam, you're muted, madam. Madam.
Madam, you're not audible.
yes.
Yes, madam.
Now
Now
it's
audible.
audible?
Yes,
Okay.
madam.
So most of the students, the very first day they get to know about, they have to do dissertation, this much page, that and all, they get pressurized. And if you get pressurized, you will become stressed, anguished, and resentful of the topic you choose, even questioning why I chose this topic first of all. Okay, so that is the thing. So when you want how to make it interesting, many a time what we do is the topic, we will try to choose a complex thing, and so that it will impress our chiefs. Okay, so we may not be interested in that particular topic at all. Just to please our chief, we will choose whatever she says, we will accept and come. What the final outcome is this. So the topic you are not interested, so it may put you to sleep, and you think it is a punishment, and so you become disillusioned with the topic, This will result in you not giving the attention what you are supposed to do for the topic. Okay. So when you want to read a little bit long drawn journey, see 1.5 years, we have to do the same topic and you have to search for it. It is thrilling, but it's challenging also. So what you do is you have to identify your interest so that you can, the foundation will be nice, you feel happy, and you can fulfill the journey very easily. So you have to identify the personal interest. So it should, the topic you have what you are choosing should ignite a curiosity. You should develop a curiosity when you choose a topic. Something excites you. Okay, this topic, if I take, I will do this. I can make so many offshoot papers. I can go and do so much search on that article. So if you choose a topic, something like that, which excites you. Suppose if you are interested in infertility. So if you choose a topic on infertility, you naturally tend to go out of the way and do things. So that will motivate you to keep going and you can enjoy doing the research. Remember, you need to look at this on a day-to-day basis. So don't pick anything full of doom and gloom. Don't pick up something topic which is not available in your area, so that you will become tired and fatigued and finally become doom and gloom. It won't bode well. Your mental well-being also will be lost. So a topic you have to choose which shows, which ignites some curiosity and excitement. That is the way you have to do topic. Another one is focus on yourself, not to the other person who she has finished her dissertation. Whatever I do, all that thing. Don't focus on your peer or your other colleagues, what they are doing it. It's good to have a reality check now and then. Whatever you do not obsess much work about the others, comparing with the others. So if you keep on comparing your dissertation, the way it's going, then you will become unnecessarily, you will get stressed. The work on your dissertation, what you do is you have to work on day-to-day basis. If you keep on comparing others, it will cause unnecessary anxiety about something that you have not done. Oh, I am lagging behind, all that. So work on your dissertation regularly. You will finish the work no matter how long it takes. The regular things you have to collect data and compile that, all that little bit every day if you do, then you need not panic at all. Okay. So choosing your dissertation topic is the first step in making sure your research goes smoothly as possible. That is very, very important. One, you choose what is the interesting topic for you, which gets excited. Oh, yeah, I can do that. I can do so many aspects of this. That is the topic you have to choose. A good dissertation is seen the way it is framed. So that is very, very important. So the tips to choose the topic is choose a topic that will hold your interest. First, keep your topic realistic and achievable. See, suppose if you are a DependB candidate in a peripherally posted, maybe a Tindukal or a Karur, that may not be available if you want to interested in doing some implantation studies, that may not be available there. You may be interested, but you cannot do that. So keep your topic realistic and achievable. Read everything you can about the subject. Before embarking on your thesis, whatever topic it is in your mind, you have to collect a lot of data about it, read everything, and do it with a passion. Don't think it is, why should I do it? It's a just strain on me. Like that, don't do it. Find a theoretical basis to support your topic. If you choose something, if you read something in depth, definitely you can support the theoretical basis. Look, there are any loophole in which you can make a difference. Somebody would have done the same topic, but if you keep on reading about it, there must be some lacuna in that you can develop it so that there will be a difference. Fine-tune to your topic based on your input from others. See, your friends also can give some suggestion. Don't ignore that, but then don't compare with others. But inputs you can receive from your friends, your colleagues, your mentor. So that is all the way you have to choose the topic. So select a topic. This is ID. So select a topic that you are interested. I've already told you. So the dissertation you have to do for so many weeks and months. Therefore, it's extremely important, the topic that you find interesting. Your motivation for your dissertation will be much easier to maintain if you have a passion for the subject. See, if you are interested in infertility, try and choose some topic on infertility. If you are interested in oncology, you can choose it. If you are interested in fetal medicine, some topic of fetal medicine you can take. High-risk pregnancy, like that. People will have a varied interest. So whatever you are interested, you take that subject. So the dissertation topic, you can do it very nicely. So when you choose a topic, it shouldn't be very vague. Suppose something comes in your mind regarding adolescent, so don't stop with that. It is very vague. Okay, the dissertation, it's an academic work. Each sentence should contribute to the construction of your research and argument. So choosing an idea that is too vague. See, you just go and tell your mentor, I want to do something on adolescents. That is very, very vague. So make it impossible to explore the topic and can make it extremely difficult to draw a concise conclusion. So the topic shouldn't be too vague. The topic shouldn't be too narrow also. Okay, so you think something about adolescent. Okay, some aspect, some issues I will choose. So that also the topic becomes very narrow. Focusing on a topic or a question that is too small or narrow means you cannot expand your arguments and come to conclusion. Similarly, when you write your research question also, that you should be sure you don't select a question that can be answered with a simple answers like yes or no. It should be little broader. Then you can make a lot of conclusions. You can arrive at so many tables and other things. So you choose good news is that in first year, you may be liking to discover in certain interest. You will develop. Some people will have a developed interest in the high-risk pregnancy. Someone will be interested in infertility. So based on that, you can select. Suppose you want to do something on adolescent psychology and sex, you have to broaden your search and search an article, not only on adolescent normal psychology or an abnormal psychology, social psychology, their cognition, thinking, all that you must have a broad angle. You have to collect so many articles on that. Once you have chosen a general topic for your dissertation, then you can narrow down to a specific what you want to research within the field. Suppose, for example, if somebody is interested in menopause health, it's a broad thing. So then you have to narrow down to the topic, because as you dig into research and understand background of your broad and taken time to consider what really interests of a particular area, there are individual studies, conclusions you choose, and challenges. Dive deeper into the questions you have. That in menopause, you collect so many things. For example, probing deeper into this narrow down areas will help eliminate what you are excited to do about it. So the questions can guide the month of original research. Okay. So you can broaden. So the broadened angle is menopause. You can narrow down to the topic, the impact of menopause on bone or muscle. So that is how you have to select the topic, which you are really passionate about it. Unless you develop a passion for one topic, it is very difficult to do the dissertation. So choose something different. It's important to choose unique topic for your dissertation that the opportunity to carry out your own research and come out with your own conclusions. And completely unique area of research is seldom impossible. Something totally you cannot have a unique this thing. I want to find a new solution, all that it is impossible. But little bit, some newer aspect. Maybe you could develop a unique idea for a smaller topic that has not been done so far. See, for example, nowadays they are talking about endometrial cells in peripheral blood in endometriosis. That is feasible, that can be done, but it is a newer study. It can be a newer marker for picking up the endometriosis. If you take such topic, definitely your interest would be sustained. So another interesting tip is the make your research topic original. Once you have decided on a topic that is interesting and reasonable based on your institution requirement also is very, very important. Okay. And dictate time to develop a fresh take on your study. Sometimes you may be interested in something, but what can I say? Your professor or a mentor, you're a guide may not be able to guide you. So you may have to change your topic also. So in some offshoot topic you can choose. Begin by self-reflecting on your passion and academic interest. That is very, very important. You do not replicate the past research. Many times I find maternal and fetal outcome in multiple pregnancy. This is a very old topic. People still are doing it. Okay. So ask the question that challenge the current ways of thinking. Find new ways to investigate in the field. Investigate methods that have not been previously used in this area. So this will be the essence of your dissertation. So something newer things. See, now they are talking about microbiota in endometriosis. That can be done very easily. And excruciating pain in endometriosis. Why don't you think in terms whether the nerve ganglia is affected in some way or other? Something like that, whether some neuronal transmission is altered. So you have to keep on thinking about your topic and any newer aspects you can incorporate in it. Then that will become an important essence for your dissertation. Where do I go and search for it? Resources. The literature search gives you an insight into the scope of the problem and provides you with the best available evidence on the topic. And sometimes we go and search the completed dissertation in the same of your topic. And books and your mentor must have enough resources on the topic you are interested before starting the project. This will allow you to expand your ideas and support or contrast your statement. So from the beginning, I'm talking to you, only you must have an interest, you must have a passion, you must read a lot of things on your topic, and then day to day, you do some work on that. Don't accumulate. So the best online sources are available now to ensure that you have an access. Latest information, make sure it's a proper resource, such as academic journals, index journals, Scopus, PubMed, Web of Science. Sometimes you have to go for some universities and professional database. Furthermore, look for articles written by experts, review articles, their advice, and it can give a insight to the topic. Peer-reviewed article, experts' opinion, case studies also will be a good literature review. It can be helpful in refining and validating your topic. And critical to consider whether the information gathered is sufficient to fully answer your research question. There is a way to search for your research question, the answer. So you have to develop all that art so that you can collect the data. So you can ask advice. There are people to help you with any question you have, no matter how big or small. When you have an idea for your dissertation or project, and some preliminary research work will help you to do further studies. your tutor will have more experience. Help, you can ask from your mentor. Okay. So he will definitely have so much experience. She would have always guided many students before. So you have to take help from your mentor. That is a good idea. But you need to have some skills, okay, to write an article or a dissertation. That includes critical thinking. I was telling to you, when you choose a topic, you must keep on thinking whether anything new things are coming, how best I can do this project. All that critical thinking is very, very important. And of course, you cannot collect data till the last minute. Time management is very, very important. Literature search and networking, and of course, the writing skill also, it counts. Okay. And special skill we require for the medical dissertation. Certain terminology we should know, and how to conduct literature reviews we should know. And patient, whether it can be applicable to that particular way, a group of patient-centeredness, it's always good. And data analysis and research methodology is a little different from the other thesis writing. So how to keep the source of inspiration? You must get inspiration. So that is easily you get inspiration when it is evidence-based. Okay, there is an evidence, I'm trying to do the same thing. So I will compare the evidence. So definitely that will keep your spirit. And the cross-disciplinary collaboration. See, the cancer cervix, they are using laser spectroscopy to find out the cancer. So if you have a physics department, you can go and do that interdisciplinary. So they will give some input. You can do certain aspect. You can compare it with the biopsy and all that. So the interdisciplinary or cross-disciplinary collaboration is always nice. And sometimes the technology you can complete. So the endometriotics, now they are injecting this sclerosing agent and then they're operating so that the cleavage and other thing. Or you can, some people are still using pitocin, so that you can select a two group of patients and compare it. So, what happened to this? What is the outcome? Whether it is the time taken is very less in this. So that will create a curiosity. So when you compare certain contemporary technology, then you will have an inspiration for you. So, and alignment with educational aims. Whenever you take a project, it should be aligned with educational aims related to health education. And it should align with social care and the patient care. Then it will become a meaningful contribution to the field of medicine. See, just because you are doing some project, it shouldn't go waste. It should be a patient-centered. It's something good you have to do for the society also. Then it becomes a meaningful contribution. So fund, sometimes we require fund also. There are methods to take receive fund. You can write a proposal to ICMR. The student projects are there. The Tamil Nadu government also is funding. You have to apply in the engineering college, Gindi, and all that you have to write a proper proposal. Then you can have some funding for your research also. Knowing how much money is available for research project and type of resources are available, help with the project will help to ensure success. Something you want a fund, if you are able to get a fund from these people, then it is very easy for you to complete the project. So the medical technology, how nowadays it is conducted. Understanding medical what technology are available as well as which one is to use for your specific study is very, very important. Having access to sufficient data sets, it is essential. If we have to have a sufficient data, you have to have a literature research, search, and must have a sufficient data. Without proper data findings, it may not be accurately reflect the reality of the situation being studied. It's very difficult to come to a conclusion. So it is medical technology plays a critical role in selecting a dissertation topic. Next comes the feasibility. It's important to assess the feasibility of the timeline for completing a dissertation. Must check feasibility of the materials. That is materials, what I mean. Suppose if you want to study about some pre-implantation study where there is no infertility clinic at all, no embryology lab at all, then how do you do it? It is not feasible. Suppose if you are sending the some material for some diagnosis, some molecular study or something like that, you are sending it to Singapore or to some other place, and how long it will take to receive the reports. So within 18 months, you are supposed to finish your dissertation. So the time frame you have to allocate that within 6 months, I have to collect the data, then results we have to analyze, then to write. You have to time that thing, how to write the dissertation. So the feasibility is very, very important, whether that particular topic you can do in that particular center and collect the data you should know. So to have a sustained interest, that is very, very important, and it has got a major impact. It is important to consider the clinical relevance and the healthcare implication and scientific implication of the chosen topic. So when you choose a topic, you must think any implication on the healthcare. Dissertation topic that has potential for advancing in the field and making an impact on the healthcare. For example, nowadays they are talking about endometrial biopsy. We have to do the latest this thing, endometrial carcinoma, the molecular thing is come. So if you, in addition to postmenopausal bleeding, simply causes for postmenopausal bleeding and the treatment, the endometrial biopsy, if you add the molecular analysis also, that is the recent thing. So it will have an impact on the patient's treatment, risk stratification, so many things you can analyze. That is how you have to sustain your interest in the topic. This will enable, when you have all this thing, that is enable the researchers to identify new opportunities for the field advancement and explore potential solutions for current challenges in medicine. So like that, there are new things are coming. Few new things are coming. Try to incorporate that in your dissertation so that you will have a sustained interest. You must have a positive impact on the field. The collaborative projects and seeking professional advice from the expert. So how do we get it? So multicentric. If you are doing one small project in your hospital, you can ask your friend to do the same thing in the another center. And one more from the next, what can I say? Either in your same city or in the neighboring city or in the district. They can do it, but you have to get an ethical clearance so that you can have a multicentric study. And you yourself can conduct a meta-analysis of your topic, similar topics, which is published in PubMed or in a Web of Science. You collect all the article and you can do a meta-analysis. So then your topic will become very, very meaningful, and it will also contribute to the medical field. So the coming to the ethical part of it, the professional integrity must be taken into account in deciding a research direction. It is essential to ensure that patient safety. See, if you choose a drug action, suppose if you are trying to do some carbitocin on a PPH, you should know about the patient safety and the efficacy of the drug you have to find out. And the clinical implication you have to choose is properly ensure that we have to tell the patient also, we have to get an informed consent. And before starting something like that, a drug trial or something like that, we have to explain the patient and get the information sheet in their own language. The potential ethical dilemma should be anticipated when you send a project also, or a proposal also. All these things you have to consider. The ethical problems which you anticipate should be tackled. And so all this ethical problems, see, when we talk about when you put on a patient, and suppose if you want to study on a AUB with a uliprisol, you know, it can cause liver toxicity. So you have to get the consent adequately addressed, and the patient information sheet should be obtained and should be signed. When you send it for a proposal, informed consent sheet should be there, and an information sheet also should be there. Then only they will get a clearance. After selecting the topic, the next task is to develop a research question. This is very, very essential. The question acts as the foundation for your study. So to find a research question, there is a mnemonics is there. Again, the question, that is your object and the aim. It should be feasible, it should be interesting, it should be novel, it should be ethical, and it should be relevant. Okay. So elicit a proper research question. The evidence-based practice to begin a research question, we use a mnemonics called PICOT. Okay. It's a mnemonic derived to get a clinical research question. It is nothing but P is the either a patient. Suppose if you want to do a perimenopause AUB, uliprisol, that group of people, it is called the patient. Or if you want to do a population study, a group of some problem in the school level, how the adolescent people are behaving in the school and how they get menstrual hygiene or something like that, then it becomes a population. So the P, either it can be a patient or a population. Suppose if you want to compare certain prenatal diagnosis, that is your research question. Which one is more specific and more sensitive? Here the P becomes what gestational age you want to do for both the test. That is the population or a patient. So what intervention? Sometimes in this it is the fetal blood. Sometimes we do some intervention like that. See, AAB, we are doing uliprisol. The uliprisol drug is the intervention. Intervention can be a drug or the test. So then we have to compare. Here, what we want to do is the prenatal diagnostic test, among which is more sensitive and specific. So we have to compare this chorionic villus sampling and lipid. Then outcome. Which test is more specific for particular diagnosis? And that is the outcome we are aiming at. And what is the desired expected outcome or objective? That is the O. P is the patient or a population. I is intervention. C is a comparison or a control. Sometimes we do a study, one group, we give only placebo, the other group, the drug which you want to experiment or which you want to find out the efficacy. So either it is a comparison or a control. The outcome, what is the outcome you are expecting? Suppose if you are giving a drug, whether it is reducing the symptomatology, how long it reduces the fibroid size, all that is the outcome you are anticipating. So here it is a test. So we are comparing the two tests. So it is which is more specific and which is more sensitive. And the time frame. Suppose if you choose a dissertation topic to compare like this, how long it will take to finish your dissertation. This is how you have to be, based on all these factors, you keep it in mind and select a research question. So what is this? So then you have to search for the question. You now have a research question. Then you have to search for the how to plan for searching. Once you have your question, you have to identify the keywords and then search for it. See here, we are using prenatal diagnostic test. You can use 2-3 keywords, prenatal test, or you can use a snippet. Like that, you can use and you can search. Okay, with a question in mind, consider which database you have to choose is very, very important. This will, which database you cannot use as you like, you cannot unauthorized database, you cannot choose and collect the information. So use strategies to maximize the search terms, like looking up synonyms you can use, or you can add 1 or 2 plurals, then you can search. So there is a way to do a literature search. So you have to search. Once you decide about the topic, the next task is the question, research question, then how to do the search. So this is the thing. First, you search the element individually. See, the gross thing is the prenatal diagnosis. Use the terms, and then you can search the other things, chorionic villei sampling and the snippet, and so many keywords you can use. First, you have to do the executing the research is the way we have to do. Then you have to refine your results. You collect all the data, all your literature research, you refine the results. There are database which already use filters to help you to narrow your research, search, then review the content. They review the research results to establish if they are necessary information, you got it. You can collect so many review, but you have to know the content you have to review and select which is very useful. Determine if research results meets the standard. You will always, you have to align with your research with so many things I told you already, whether it meets the standard protocol. Then how to structure your dissertation, I think by now you all know. And identify the research question, then review and design, execute your own research, and you know which type of thing, whether it's a quantitative or a qualitative type of research, you should know, and then draw conclusion and present it. That is the structure you have to do it. But anything you need a style, you know. So the way you walk and everything is, we require style. Similarly, for writing a dissertation, it's very, very important to have a style. It should be clearly convey the purpose and the message. And this can ensure that your paper has an analytical depth and theoretical growth. Careful consideration. You have to create properly an effective style. The way you present, it's very, very important. This is the overall success depends upon the way you write the article. The presentation should be crisp and neat. And another important thing is you can suggest at the conclusion the scope. You can suggest the scope in future. This shows that you have a critical, reflective attitude. You can suggest this future research, future scope at the conclusion. So the possible outcome with all this, so many things we are talking, what happens to your dissertation after completion? It will be almost forgotten. Wow, every professors will agree to that. It will be in the your college library. It may be used by another student. It can contribute to the research of your supervisor. Many a time the supervisor are using your topic. And sometime we publish, and sometime you will have it will go at the national or international research project. And but when you have a social impact or a healthcare impact, don't give up. You can go up to international level and you may even win a Nobel Prize. These are all the outcome. So dissertation is not a life or a death. It is certainly is not worth having sleepless night over. See, look at her. Rara, rara. So don't have. You have to have a happy, the way you have to have a passion for that. There should be a purpose for that. Don't get stressed. Okay? So try to adjust your balance. How to do that? There are many factors in the process of research which cannot be changed, like time, the resource, the institutional requirements. But you can take time how to plan it in a week or a month and a year. You follow these tips, work a day-to-day basis, then there won't be any problem. You have completed, it is your original work. You can be proud of yourself. But unexpected things can happen. So you have to give some allowance for that, but your perseverance is going to give you the answer. It will definitely help. So this is how we have to adjust our time. A well-written dissertation is your showcase and your unique abilities and the professional temperament it shows. So choosing is very, very important. Take a time and pick a good topic for your dissertation. Choose a topic that is feasible within the given time frame. Discuss the proposed topic with peers and experts. Make sure resources are available online. Must have positive impact on the field. The topic should benefit your future career prospect. That is why I told you the topic which you are interested, definitely you will peruse it for lifetime. Suppose if you are interested in oncology, definitely you can become a gynec oncologist, can do a paper presentation, you can be an editor. My students have become editor of British Journal. So that is how you can use your future career proposal. So the two keys is passion and the purpose. This journey, I'm sure the journey is demanding, but sustaining motivation is the key. Choose a dissertation topic that not only aligns with your academic pursuit, but also sparks a genuine passion. A meaningful and purpose-driven dissertation topic will keep you engaged throughout the process. Right? It is a self-discovery, scholarly exploration, and practical concise. By reflecting your interest and ensuring the feasibility of your intellectual pursuits, you can contribute meaningful to your field. So enjoy doing dissertation, right? So if you do what you enjoy doing, you will never have to work hard, right? And the only way to do great work is to love what you do. If you haven't found it yet, keep looking. Don't settle. As with all matters of the heart, you will know when you find it. With that, I close and thank you one and all for patient listening. Thank you so much.
Thank you, ma'am. It was really amazing. I just want to be again a student of you, ma'am.
Okay, thank you, Deepa.
So,
You're always welcome. We are learning every day.
seriously, madam, your tips on narrowing down from the topic selection to narrowing down to the topic and how to do a literature search, how to use PubMed effectively, and what are the possibility and how to do it practically. Thank you, madam. It was an amazing advice. Also, your advice on positivity and staying motivated. Your slides are very, 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 very enthusiastic, ma'am. And as you say, the students have to make a day-to-day goals and they have to have a sustained, then only they have to have a sustained interest throughout. They have to keep their moods elevated. Thank you, ma'am. Priya, do you want anything to say?
Yeah, actually, it was like, so mesmerizing. I could not even like take my eyes off the slide for 1 minute. I even took notes like how I used to do it in the PG days. I will share my notes also.
And I'll keep
almost
talking. I keep talking the presentations and put it in the students group.
Yeah, I'll do that. Actually, few things which I really loved it. One was like Jyotika's, before and after picture. More clue about dissertation for
You're
PG.
looking like now.
Appear like now how do I do without makeup and with makeup is the same thing. Like PGs don't dress up, they don't brush up, they will be just sitting with the like the final months of dissertation are like literally maddening. So madam, you made it very easy and it sounds so simple. I hope the PGs took some tips for that. Doing the work every day makes it very simple so that the final day of submission you not get scared at all. So lovely and beautiful quotes, madam. Excellent talk. Thank you, madam. Thank you.
Sagiti, now we'll move on to the next speaker. Madam, please stay back, madam. There will be a question session at the end, ma'am. Epsi, ma'am, please stay back. Dr. Nikita Prabhakar. She completed her MBBS from Sri John's National Institute of Health Sciences, Bangalore. She pursued an MBA from Annamalai University, Tamil Nadu. She further enhanced her skills with health research methodology course from St. John's Research Institute, Bangalore. She is currently serving as a regional medical advisor South. She brings a wealth of knowledge and expertise to her role. And last year, we had an amazing talk with Nikita in research methodology. So now she's going to talk about on manuscript writing. Over to Nikita.
Just a small adding on. We had a series of lectures from Nikita madam. We had it for like 4 or 5 weeks, which stretched over, and she like took it as a research methodology workshop. So she did a very good job. So I hope she'll give us a very good insight on this topic as well.
Yes.
Thank you, Dr. Deepa and Dr. Priya. Absolutely very kind words to hear. And I'm very happy to be back here with OGSSI's research committee. Yes, I did have the pleasure of working along with Dr. Priya and Dr. Deepa last year. But before I start, I just wanted to say, ma'am, cover.
Your voice is breaking, Nikita. Sorry.
It was
little breaking.
Is it better now that I turned off the video?
Yeah, now it's better. Yes.
Great. So just wonderful in her presentation. I think he pretty much summed up how to go about doing the entire pieces right from inception to outcome, and it's absolutely brilliant. I thoroughly enjoyed Madam's talk. Without any further ado, I'm going to share my screen. Primarily, I hope my screen is visible.
Yes.
Yes. So I'm going to start. I'm going to keep my presentation quite brief, owing to the fact that I was told we have about 15 minutes or so to go, and I'd be happy to keep it short because, like I mentioned, Professor Hepzibah has covered pretty much everything. This is just a brief overview of how to go about putting together your paper. So now let's say that you are at a point where you have already framed your research question, you've already formulated a hypothesis, and you are now at a point where you want to put together an idea of what we're covering today, essentially the introduction of what is the anatomy of a manuscript. Let's dissect it a little bit part by part, and a little tip about how to write each of these sections. So a few notes about some technological enablers. I have mentioned just
Nikita, your presentation is not. Nikita, sorry to interrupt. The presentation is not in a slideshow. Can you make it a little bit?
Is it better now?
It's better now.
Yeah,
Thank
now
you.
it's better. Yes.
Okay. So so we'll talk a little bit about technological enablers which do help us. I will probably get into it during the Q&A session. I just want to touch upon it very briefly here. And then we'll also talk a little bit about journals and making just the art of better medical writing. Now, why write? Number one is naturally to advance professionally, to qualify for grants. But to talk about it more personally, it is for personal satisfaction and development. It is to learn. Research always adds incremental value to science. And we first, and then clinicians, it is our, if anything, to not only enhance the knowledge of the field, but to personally enhance our own knowledge. So for that satisfaction and development, it is very important to write because writing involves a lot of research and a lot of reviews, and it only enhances our knowledge, if anything. So these are some of the reasons that we come up with not to write, right? What we don't have time, there's unfamiliar process because we don't know where to begin, where do we start, and where does it go? What is the process? And probably we have done this before. We've had some bad experiences because of our papers being rejected, because after all the trouble that we went into putting together a paper, maybe there have been rejections in the past. So these are some of the reasons that we think of to not write. However, I would say give it a try, because lack of time, I'm pretty sure that which help us to plan the time, surely will be able to make and accommodate time for a research paper. In terms of the process, truly, it's really not that complicated. Trust me, it sounds like a very big deal, but it really, really is not. It is just, if we understand the system and if we go about it in a very systematic manner, it really is not a complicated process. Coming to bad experiences, well, I suppose it's just a mindset of accepting that everyone gets rejection at some point in time, but persistence despite rejection is what pays off. Now, in terms of the parts of the manuscript, let's dissect a manuscript and talk about the most important or the broad sections, right? Ideally, we would follow the IMR80 format, which is introduction, methodology, results, and then the discussion. Now, the abstract of your paper can either go right at the top or right below, as I'm pretty certain that when we've gone through multiple papers, we find the abstract right on top, right? So that is most commonly the format that's followed. Abstract on top, followed by the IMRAD format, which is introduction, methods, results, and discussion. Now, right before all of this, introduction, methods, and results and discussion, we have on top the title. Now, the title, right, because it identifies the meaning of the article. So when we work, like for example, and we're looking at, let's say, management. What is the first thing that we say? Drugs in the management of endometriosis, surgical intervention in management of endometriosis, post-surgical management of endometriosis, right? So we have specific ideas in mind when we're searching, which is why your title should address the main issue of what is exactly encompassed. Then begin with the subject. Make sure that it's accurate, it's unambiguous, it's specific, and when possible, it should also be complete. At the same time, don't make it too long. It has to be as short as possible. Now, when I say as short as possible, doesn't mean you just write, endometriosis as your title, right? It naturally needs to be a little more. Of course, making it interesting so very much helps. For example, identifying the article's main issue is, are statins useful in patients with advanced chronic kidney disease? Right? We're very clear. Then here, the main subject matter is I wanted to look into papillary thyroid microcarcinoma. So that is right there in the outset itself. Keep it accurate, unambiguous. See, if you look at this exactly gives you what I'm talking about. What are the studies? What is the study about? And what is the drug that I'm trying to investigate? At the same time, there are examples like this: obesity and the health of future generations. Simple, easy, short, and it covers pretty much every the topic, isn't it? Now, if I put this, see, GLP-1 receptor agonist and SGL2 inhibitors, a couple at last, is very definitely interesting, it's enticing, and it piques your curiosity, right? It makes you wonder what exactly have they looked at and what kind of a coupling are they talking about? Where does it help? So these kind of titles also work. Now, this I mentioned, abstract, I put it at number 6, but you can always feel free to put it right on top. Now, about before that, I'll just go through the order here. Tables and figures right on top. So if you've noticed, a lot of the papers when you're doing your literature search, you find the figures, the tables right on top. And let's be honest, when we're looking at studies and we're looking at data and rushing through, let's say 30, 40 studies at a time when you're doing your review, you look for tables, right? You look for those quick, concise boxes which pretty much summarize the entire section. You look for figures and graphs where you can see and understand and interpret most of what is in the study based on these tables and figures. So they go after that. What is the findings of your studies? Then the methodology of how you came about to do this, followed by introduction, discussion, and sometimes in the end abstract. Now this is how you would submit it to a journal. I will just go through each of these sections in one slide to just talk about how these need to be presented and talk about a few tips on how to present it. So tables and figures, as I mentioned, of your story, right? Because editors, reviewers, readers, they may first and maybe only look at the title, abstract, and what is the tables and figures. Now, if I ask for a show of hands, I don't know if Zoom show of hands. If I say when read a research paper, how many of you read the entire paper? And how many of you only went through the abstract, looked at the copy pasted? I'm very sure that out of the 48, 49 students, 45 at least will raise their hand. Because let's be honest, this is what we do. That is the reason these have your table figures should be so good that they alone, stand alone, can tell the complete story. So the reader may not even have to refer back the main text. When they look at the table itself, they should be able to figure out, for instance, from the forest, this is, that is where it lies. So based on the study, looks like it's more inclined towards the drug in everything is right from that graph, right from that table, right from the figure itself, right? Now, when it comes to tables, you, as much as this is going to sound like
I think some connectivity issues, no?
I know.
It shows like she's left.
Probably
wait.
she's traveling, I think.
Yes, ma'am. Yes. She said her flight is on the way. She's in the airport, she told me, ma'am, but she's not yet boarded.
is my screen is visible?
Yeah,
No.
you left the meeting, but now your screen is not visible.
Okay. Again, I suppose, right? I'll just do that.
Yeah, please share it again.
I'm sorry.
Yes, screen visible.
Okay. Is this all right?
Yeah, I mean, slideshow full mode. Yes. Okay, thank you.
Perfect. So, as I was saying, when we were talking about tables and figures, don't use the same data in both a table as well as a figure. Okay, for example, let's say you're talking a demographic information that you'd like to present in the table. You do not need to put the same information in the form of a graphical representation as well. You're wasting space and you're wasting, basically space where you could have used that space to represent some other part of your paper in the form of a table or a figure. So use figures and tables to tell the whole story, but at the same time, you can manage this by not using the same data in both a figure as well as a table. Coming to the results section, you should not organize the section by the order in which you did the work. Rather, make the narrative a logical progression. So, talk about participants, description of the sample. Who did you exclude? Who was lost to follow up? Who did you include? What were the primary outcomes? And finally, add tables and figures to complement the text. A few tips here: include only findings that flow from your method section. Be sure that the data in the tables and the text match, okay? Because there have been many papers that have been rejected for this very reason. In fact, it's gone as far as getting and then it's retracted. I'm sure you've heard of recent ESHRE study of Hennetal that was presented. He's talking about the safety of progesterone, dihydrogen, it was talking about safety parameter. Now, in that, it was presented in such a way, and in tables, the numbers do not match with the of the whole paper. So please make sure talking about data from the tables and the text, they need to be in alignment. Now, all main object. Do not interpret or comment on the findings. The results section only to project what your study has found. That's about it. Do not comment on it. Now, what verb or tense do you use? Use past tense for completed actions. For example, we found women were do, or men smoked more cigarettes than. So completed action, use past. Now, when it is for ascertain that continue, like in the table, what is the table showing, what you believe, what is the data suggesting, use present tense. For example, figure 1 shows the findings confirm that the data suggests that we believe that you're talking about what you believe and used to be true. Now, you need to always, as much as possible, use active voice and here. This statement here is a passive voice. Okay. The activation of calcium channels is induced by the depletion of endoplasmic reticulum calcium stores. Rather than this, use the active voice in saying, depleting calcium from the endoplasmic reticulum activates the calcium channels. Keeps it short, it doesn't unnecessary. Also, another tip, great authors use we and I because no work is a standalone work, right? It's always a team effort. And if you remember, Professors Watson and Professors Crick they formulated this beautiful paper, which was the basis in one of the first in our biology textbooks, which was about deoxyribonucleic acid, right? So here they celebrated the 1953 paper Nature by saying we wish to suggest a structure for the solver. So again, great authors always be an I because you are that results. Now, coming to the let's method section should be written as the recipe for the studies design so that other people can also reproduce the research when they want to do so. So what should it contain? We should talk about the study design, about enrollment, about the variables, what are the measurements and data, and what is the statistical analysis. A few tips here. Make sure that you see when you're submitting it to a journal, they would have given you an author's instructions, so specific reporting guidelines for that particular follow those study designs. Now, how do we get this? There are links to these are few links which will help you reach these guidelines. Now, what are these guidelines? For example, if you're looking at trials, you have a consort guidelines, which stands for Consolidated Standards of Reporting Trials. You have the quorum guidelines for meta-analysis, guidelines for systematic reviews and meta-analysis. The strobe guidelines for observational studies in epidemiology. So you have different types of guidelines which are available by organization, which helps you to maintain the system that ought to be maintained. Now, coming to the next section, which is the introduction. This introduction should always include a concise review of all the literature that we have, relevant literature. Why? Because, see, when we talk about why we have done a particular study, you're trying to provide rationale. Why did I do this study? Because you're trying to help the authors or the people who are reading understand or give them context or rationale study. So you talk about context and rationale. Why is the study done? What is the problem that is being addressed here? What is known already? Meaning to say, what is the knowledge gaps that exist? And how will this contribute? Then include a statement purpose. Meaning at the end of the section, you position a hypothesis if appropriate and if possible, and include the statement of purpose of doing this stuff. So this should ideally be the idea. So a few tips here. Make sure to be concise. Do not underestimate what has already been published. Okay, please do not put down any study. Keep focused, know your purpose, and state it clearly. So don't be unambiguous, going all over the place saying this study says this, this study says that. It should not look like you are lost. Know your purpose and state it very clearly. Now, just to understand or remember, this is a cone here. This should be the order in which you begin your introduction. Right on top or right in the beginning itself, you go from the broad section of talking about the background, what is already known information, what is a knowledge gap that's present in the area, what is some unknown information that is there, what is then finally your hypothesis, what is your question, what is your purpose and statement, and finally hit the nail on the head. Talk about what is the approach, what is your plan of attack, and what is your proposed solution. So you understand it's going from a very broad section of what is the background to right to the pinpoint of what is your approach, plan of attack, and proposed solution. This is a simple framework to give you an understanding of how you need to write an introduction. Go from the known to the unknown to your hypothesis or purpose. So coming to the discussion part of it, this is the most difficult section to write because it requires the author to interpret, but of course not over-interpret his or her results, right? So what are you doing here? We're talking about the summary of all the main findings, the significance of all these findings. What is this new knowledge that is being contributed? And how does this compare with what has gone before? What are some of the limitations that you came across? I'm certain that, when we've read studies, as you're reading the discussion, they themselves will talk about what are the limitations of the study. And what are the future research directions saying? In the future, this is something that needs to be studied more. I'm certain that with more research in this area, we'll yield more results. So these kind of statements are there right towards the end of the discussion. And finally, conclusion of your discussion. Now, a few tips is it helps to read similar articles in your target journals for examples, how to go about writing discussion. So that way you will not be too overwhelmed or alarmed. You'll have an idea of how to go about writing the discussion. And discussion part, just to give you a clue, is the inverting of upright, right? Inside out, meaning to say you went from background to the pinpoint. In the discussion, go from pinpoint to the bigger picture, right? So you talk about, first and foremost, answer the question that you asked. Then go to support your conclusion with your data and other supporting data. Then defend your conclusion and make sure that you anticipate criticisms here. And lastly, give the bigger picture, give the big take home message as your conclusion. Finish with a bang. So in simple words, invert the cone. Lastly, coming up, see, the abstract is the mirror of the entire manuscript. As we all agreed, most of the time we end up reading only abstracts, especially when we're brushing through, let's say, 30, 40 articles in a day. So make sure that it is a mirror of the full manuscript. So it is primarily a condensed version of the complete paper, commonly about 250 words, structured by headings. If it's unstructured, if you notice, you'll be just a single paragraph without any headings. Those which are structured will have background, objective, methodology, and finally conclusion. But there are also abstract where it will just be written abstract on top and there's an entire paragraph which talks about the entire study. So it can be either structured or unstructured. Now, coming to a few tips here, use words that will help in electronic searching. Some authors write abstracts first to help them organize their thoughts. That also can be done. Always double check before submitting. Now, writing the abstract first is completely up to you. It's not a compulsion because if you already have the entire paper in place, putting the abstract is not at all a matter because you have the entire paper just about summarizing it in 250 words. So it's not at all an issue. Contrary wise, if you feel like writing the abstract first gives you a structure to know what exactly go handing it into larger paper, please feel free to do. A few strategies. Planning is key. Extensive literature about develop expertise. How? Practice, practice, practice. Learn how others have done it. Trust me, everyone is new when it comes to research. There's no such thing as I can never ask somebody, how can I, this is such a small doubt. No, please never ever think like that. Always feel free to approach your peers, approach your seniors, approach guides and mentors first and foremost, and learn because it always helps to keep learning or upgrading one's knowledge, and also identify the gaps. This happens when you do extensive amount of literature search. You yourself will be able to understand the pattern of the studies that are being done and where exactly you can fit the bill. Now, research starts with a review, advances to a study, and expands to a publication. By Professor Thomas Rosenthal. We also have another quote from our Harvard professor, Professor Cliff Dublin, who said, "I never think what's needed to get published. I think what's needed to." So, in short, if you focus on answering interesting questions, the paper take care of themselves. This is nothing but, if we can just re-quote Professor Hepzibah itself, this is very similar to what Madam has also been saying right from the start. Now, grant support, I don't think this will be very relevant to you guys just yet, but maybe you can start thinking about authorship, especially if you're looking advancing in your career. See, once you finish your post-graduation, Abba, thesis is done. That's all. My life is over with research. Okay, that's a wrong attitude to go in with because research is something that is continuous. Research is something that is always going to add incremental value to your own resume and also to science. The more studies you do, the more you're adding credits and validations to your own self as well as science, right? So please do not ever give up on the idea of doing research immediately after submitting your thesis. Okay, I hope that many of you will also continue to do more papers and more researches as you're getting into becoming a senior resident or assistant professor, associate professor. Remember, these promotions do not have a sufficient amount of research papers. Also, I believe there are some new regulations in place, but I won't comment. Now, coming to a few tips, the needs section of a grant to this because it's a little bit more into how to get grant support. So let's move past this. Now, technology are okay, these help. There are many areas now, actually in place. There are so many areas where technological enablers help us, right? It helps us keep an what do I say, bibliography software. Helps you keep an organized library, helps you with headings, subheadings, topics. It helps you organize your entire text. These are just two of the softwares that I mentioned here, EndNote and Zotero. Maybe I'll get into a little bit of it if we have a Q&A session. But these are just a few to mention. ChatGPT, yes, it is something that is lately been helpful to help structure and organize. Please do not completely rely on AI because it's always a balance between humans and AI that brings the right essence to a paper. So I hope technological enablers should just be used as enablers and that's it, not as a 100% reliance on these. Now coming to planning effectively for an original paper, number one, have a very clear research question in place, seek statistical advice, use the study, act ethically, keep an open mind, minimize bias as much as you can by doing the right form of sampling methods and all of these in place. Organization will help you mostly. Agree to publish even negative results. This is how open-minded you need to be, because end of the day, it's not about your personal belief. That's why I didn't publish it, I did not think that way. No, please do not ever think like that. You are doing it for science only, so whether you got the result you're hoping for or not, ensure to publish it. Now, behave ethically. Yes, I don't think I need a slide for this, but I just wanted to add it in just to mention the GCP guidelines. Now, in what includes publication ethics is to avoid misconduct, protect patients' identities, report clearly with informed consent. If there's any deviation, if there's any risk on exposed participants, benefits to participants or society, ensure to mention it. And it's not always enough to state that the study was approved by any ethics committee or IRB. You also need to have been, ethically conducting the study. Now, make sure to protect the patient confidentiality in terms of age, sex, location, clinical details, unusual context, even photo, even if it's of a body or clinical image, make sure to be aware of identifiers. Now, if you look at editors and reviews of journals, frequently encounter manuscript issues. These are issues. Now, what are the most commonly seen are the ones marked in red. Poorly written, excessive jargon, inadequate or inappropriate presentation, poor description, more encounters with reviewers and editors. Okay. Now, being boring is the least of their problems. See, it is right in the last leg of the histogram. So please do not be too about being rather or not being poorly written, having excessive amount of jargon, or being inadequate in your presentation. So clear writing includes short, familiar words. Don't have to try to use thesaurus and make it very complicated. Avoid acronyms. Be specific. Be concrete. And say what you mean and mean what you say. Okay, this is keep it more clear, honest, and this. How to respond to reviewers? You will get your review back. Make sure to read it carefully. Take a deep breath. Consult your co-authors and prepare a response table. This will help you do it in a very systematic manner. Now, this is one of the softwares called Authenticate. This is a software which helps prevent plagiarism in published works. There are many other softwares also. And I just wanted to say one thing, perseverance is key. Never ever discourage with feedback from colleagues, journal editors, guides, because writing is something that we all need to constantly work on. So please do not be discouraged and give up. If anything, these rejections should only push you more forward to pursue, improvement and betterment in whatever we do. And it only makes us better. Rejection or failure as a stepping stone to success is very oversaid and very overstated true, but it is very, very true as well. So with that, I would like to end my presentation and I'll be happy to take any questions now.
Thank you, Nikita. That was a very nice presentation. And you started with the research is for the personal satisfaction and for personal development, and it should enhances our skills rather than it's just for the projection. And also the right word that we should not stop these dissertations as after PGs once the post-graduation is over. So research is a continuation done. And your cone for intro and conclusion was a very good methods to follow it up. And at the end, we should not put down any study which already published is a worth word. thank you, and your presentation in the neat methodology is really great. And we want your continuous supports in other clinical meetings also, Nikita. Priya? Priya, are you there? Sakiti? Shall we go into question answer session, Sakiti?
Yes, ma'am.
I think these are the questions we have put a Google form. The students only have filled up the questions. So out of the many questions, we selected few questions, almost 15 questions only, Nikita and Epsi ma'am. So the first one is, as I already asked, as already you quoted in your topic, so it is appropriate to use chat GPT or artificial intelligence in academic research. So is there
No.
any ethical consideration?
No, actually, the authenticity and creditability and ethics is questionable. Actually, okay. Then the World Association of Medical Editors, they have told AI, like all this chat GPT and all these things, both from ethical, legal standpoint, should not be recognized in scientific literature authorship. We should not. And you cannot use AI content in your work directly. And most of the institutions, they don't even allow that. AI-generated content.
Okay. For the manuscript writing, Nikita, will AI technologies will be useful?
So, Professor, has a very good point. Something was very question. I did my research AI being used in research, and I found that there's in fact a systematic review, which studied about 24 study data right from how AI impacted academic. The study goes there, while it demonstrates significant potential in writing, challenges in terms of academic integrity is something that is questionable. The balance between human and AI,
Right now,
I
we cannot use.
Okay, ma'am.
Authenticity
Yes.
is not, it's a questionable. Lot of authenticity, creditability, everything is questionable. Right now, it is not advised to use it.
Okay,
Though
ma'am.
it is tempting, it's easier to do it.
Yes,
So,
quite tempting. There are tools, only tools like Zoho and to make sure that you using chat GPT, what if it is a reason for the paper to get rejected? No, why would we want to risk it? So
Okay. Okay. The next question on topic selections. What are the criteria for selecting a suitable thesis topic? I think Madam has extensively talked about this. So, any essential consideration for beginning of my thesis? Any more tips, Madam?
yeah, it should be flexible. You have to choose a topic which is very useful to the society, which is making interesting to you. So many things we have told, no? It should be manageable. And that's actually Nikita has told. It should be a continuous process. So something which is interested, you have to, what you are interested, you should choose. Then it will be a sustained thing. If somebody is telling you to do it and pressurizing you, you will not do proper dissertation. You choose the topic which you are interested. And that should be feasible. That should be done in your center. So some high-tech thing you choose, and if you are not able to do it, then there is no use.
Okay.
Hello?
I am there. Okay.
Am I
So
audible
the
now?
interest is you are audible, ma'am. So the
Mhm.
basically the interest must be the first things, and that with can't be practicability is the next most important things in choosing the topic.
Yeah, passion for that. And there
Passion.
should be a purpose for it.
Okay. Thank you, ma'am. And regarding ethical committee questions, is all the research topics has to be get a ethical committee approval or
Definitely.
definitely. It's
Actually,
only the
if you
drug
want
related.
to, yeah, I'll tell you, if you want to see the dental condition, whether it can go for preterm labor, you have to take ethical clearance.
Okay.
Even for small things, it is mandatory.
Yes, madam. My topic was like, to compare two GTT criteria
Yeah.
about, and for that also I went into ethical clearance. And for that, I
Yes.
wrote, what is the side effect? I said, there can be pain because of drawing blood. And the ethical committee started laughing because like that is a topic on GTT. So they said there's no, I told them there's no side effect. Then they said it's okay. And don't write this and all as a side effect, like, drawing blood can cause pain. So but whatever it is even the smallest topic.
But that should be included in the information. So much ml is drawn. It will not hurt your, it will not reduce your hemoglobin. It will not this thing. There is a little amount of pain when we prick. All that should be written clearly in the information sheet so that you will be protected legally and ethically.
And
So as soon as
even for the papers and other things which we present in conference also, actually, like many of the centers, they ask for ethical clearance. Even for that, they should undergo them. Even the papers.
Yes. Ethical clearance we should do. For publication, definitely.
so ethical clearance, Priya, it's only for the studies. It's not for the case report, right?
Not for the case reports, madam. But
It's only for the studies.
Yes, you have to do the ethical clearance.
Okay.
Even
So
for retrospective study, we have to get clearance.
Yes.
Even for retrospective.
Even for retrospect, like if you choose few cases and you compile and you're going to present it, then you have to get the ethical clearance, madam.
Because why? Because we are taking
present and publication, you have to get a ethical clearance.
Because we are using the patient's data, madam. So the ethical board has to approve that so that the patient's data can be presented somewhere.
Okay. So each and every hospital's medical institute will be having an ethical committee of their own. If they doesn't
They should have.
Yes.
Apollo, they have.
In Meta, they have, madam.
Yes, we have. Apollo, we have.
Madam,
Apollo, I'm one of the committee member, pa.
Oh,
yes, madam.
Every institution will have
called us saying that you cannot present without our knowledge. Come and clear the clearance and then go and take it and present. So we know that.
Okay, moving on to the question
ethical clearance, they will ask ethical clearance number. All index journal, they will ask.
Okay. For the publication, they'll ask. For the paper presentation, they don't have no one. That in-hospital ethical clearance approval is that. That's enough.
But the hospital
we are little lenient. We are little lenient. That's it. So that when you are doing retrospective study itself, we are supposed to get ethical clearance.
So
only difference, you will not have the this thing, informed consent paper in retrospective.
So we don't have to have.
Is it for e-journals also? Yes, for every journal, yes.
Yeah, for every journal.
So once you publish any studies, you need an ethical committee. So we'll move on to the question 4.
Yes.
It's regarding the data collections. What is the initial steps in gathering data for research and how do I interpret and present quantitative data in my thesis?
So
it's
that
very
is a
vague
data
question.
collection itself is a separate topic.
Topic to be discussed.
Data collection means collection of the facts, figures, events, and from the different source. It can be a quantitative, it can be qualitative, it can be primary data collection, secondary data collection, so on. So it depends. So it is a separate topic. Actually, initial data collection depends upon your study pattern, whether it's a qualitative or a quantitative, and a lot of statistical things, all that is there. So it's a separate topic on its own.
Okay. So Priya, we have to do a separate topic, one session on data collection.
Data collection. Got it.
Okay.
Got it.
Question 5. Next question, ma'am. Okay. So this is regarding the studies. So this is again a vast topic. What factors should I consider when selecting a research methodology for my thesis? In an RCT, how do I present the results in percentage or absolute numbers? And one more is like, could you explain the consideration for determining the sample sizes in control and case studies?
For sample size, there are different formulas are there based upon your topic. Okay. So there are 2-3 sample sizes that are based on the population incidence, based on your hospital incidence. So many things are there. There are set calculation, sample size calculation. Like iron metabolism, we are calculating like that. There is a sample size calculation is there. And then regarding the statistics, actually, for example, the statistical analysis vary depending upon the type of the topic. See, for RCT, there are so many statistical analysis like a t-test, ANCOVA, regression models, mixed models. So statistical analysis, there are set rules for this particular type of research. We have to do certain analysis. Okay. So you can combine one topic on statistical sample size and statistical analysis. So these are all, I think they would have finished all this thing in the research methodology exam.
And we have the first years also, madam, who are just joining also. So questions like they could have framed that. And like, I think every hospital will have a statistician as well. Like, whoever is having candidates who are presenting.
And biostatistics, little bit of biostatistics we should learn. It is little different, but we have to learn. Otherwise, the statisticians, they may not understand our pattern. We should explain certain things. Biostatistics, we should learn.
Okay, statistics is the one ignored subject in the undergraduate in SPM posting, madam. Now, in a
that is our
postgraduate.
fault. No, that is our fault. Now they will realize the importance of statistics.
Okay.
Not that hard.
Is Nikita is there? Priya, Nikita is there?
Yeah, she's there.
Yeah, that's good.
Okay. So Nikita is
Hi,
not
am I
there.
audible?
Yeah, you are audible,
Yeah.
Nikita. So
Yes.
you are say about the research methodology question.
Yes, I believe, I completely echo with what Professor said. Most of it, so I wasn't really putting in these things. I think there are considerations depending upon the type of study design. You have formulas in place for calculating the sample size, so that would be the right answer for that. In the second question, this would be a question from my end itself. Wouldn't absolute numbers be preferred for cities, considering it's a controlled environment? Percentages also add out, but absolute numbers would be a better bet. I mean, it's my thought, but I'm not sure. I think professor will be better.
Okay, statistician. Okay, the question number 6. This is regarding again statistics. I find statistics are challenging to comprehend. Do you have any advice?
Go and learn biostatistics. Madam has already told us that.
Somehow you get interested in that. 1 or 2 class, it will be boring. Then you have a purpose now. So automatically you will start learning something. Not in depth, a gross thing, sample size calculation, for that particular type of design, research design, what test we have to do, all that, if you know, that is more than enough.
Actually, madam, I think our OBG department is little lenient. When they come to present papers, we don't ask them in depth about the statistics points. Whereas the other physician department, they go in depth about these biostatistics questions. And I think, few people say, they get royally, too many questions only based on how they did the statistics analysis.
Yeah, we are more lenient in all our
actually there are a lot of software is there. That's a lot of software also they can use. So that itself will teach which this thing you have to do. See, for example, specificity, sensitivity, positive predictive value, all that there's a formula, there's a calculation. If you put certain things, it will give.
We'll tell Dana madam and Vijay madam in all the paper poster presentations. We have to ask in-depth questions. All the case studies, in-depth questions on statistics. Then these girls will read and come.
True.
Then they won't present the case
Then
at
they won't
all.
present, no paper will get.
No paper will come. No, actually, that is, if we know little bit of biostatistics, that is more than enough. Okay. So we need not waste our time. We have to give a data. We have to tell what is our outcome, what we expect. All that we should know. And what particular analysis we should do for our own this thing, design, research design.
So we'll move on to the question 8. The first one in the miscellaneous question is, how can I efficiently summarize my thesis topic? Someone's thesis topic is investigation of fetal maternal outcomes in obstetric HDU at a tertiary care hospital.
This is actually, I think if they have listened to Nikita's conclusion for this thing, inverting the pyramid
Cone.
and this thing, cone. That is it's a summary. It is just a summary. Anything
Conclusion.
summary means right from your aim, your objective, your methodology, the results, and the conclusion. You summarize it. Little bit elaborate than the abstract. You have to summarize it. Summary. That's it.
Okay. So what is the process of creating a synopsis? Again, the same.
Abstracts.
Synopsis, again, a shortened version of your work.
Abstract.
When they do the PhD and all, we have to send the synopsis first to all the examiners. It is a shortened word of your original work.
Okay. The third question is, how do I address potential limitations or biases in my research? How do I know that it is my potential limitation?
No. The bias can come from so many areas. The bias can start right from your planning, conducting this study, planning the study, and then the research bias is there, reporting. So many places the limitation has come. If you happen to find some limitation, okay, this part I could have done, and further results I could have got it. You put it as a limitation and spell it out in your thesis, that dissertation, and you put it as future scope, future research. I'll continue to do the research.
Yes, there was a beautiful point in Nikita's presentation. She said, like, you need not have always a positive result in your study. You just have to do the study, and whatever the results comes, just go ahead and present your study. It is just that your study has given you
No, the bias will come. Suppose if you think the outcome should be like that. Okay. If I give uliprazole for a AUB, the fibroid size should come
down. Yes.
That outlook you will be having. So if there is there is no fibroid reduction or volume, we will leave that thing, that result. That's how every stage a bias can come. And if you find, you can write it down as a limitation, and you can point the same point as a future research. Continue to do the research so that it will be this thing. So the limitation, that is how we have to solve the limitation in so many stages. Bias can come in so many stages.
Okay. And the fourth one is interesting. I think, how do I handle a feedback from
advisor, committee members,
especially if it differs from my own ideas, like if negative feedback.
Agree.
No. What I suggest, to go smooth. Okay, to go smooth and then get things done. You can try and explain to them to some extent, but you try to incorporate their advice into your topic. That will be the wiser way of doing things.
Correct.
Your aim is to get degree also, no?
Lovely, madam, lovely.
So not only the vigorous research. So this way, that way you have to, that is why it should be a manageable. You should try to manage. If some suggestion is given, try to match your, what can I say, your ideas with them, something.
True.
So immediately don't bounce at them. Don't say, no, madam, I saw this research. I mean, I searched this literature, there it is given, this thing, like that. You observe that, their feedback, then you come and try to, 1 or 2 points, you incorporate in your topic, then you go and discuss. That would be a better way. See, we don't, as per ethics or legal, we don't want the husband to sign for sterilization. Why we are getting sterilization, husband sign? Just to run the family smooth. Like that, we have to adjust certain times.
So the final question number 9. This is like, how do I balance my thesis work with other academic and personal commitments?
I think I put a separate slide for that.
On Jyotika.
அந்த ஜோதிகாக்கு அடுத்தது ஒரு
அடுத்த slide, balance. Certain things you just cannot change, right? The time frame given and that your institution requirement you cannot change. Suppose your mentor is certain, having a fixed ideas about certain things, you cannot change, right? But whatever gathered, whatever project you are trying to do, you do day to day and keep gathering everything, analyze then and there. Unexpected things can happen. So all that you have to adjust. If you, main thing, you must have an interest. Don't think it is a burden to you. That is my advice. If you have an interest, yes, I have to pursue MD, I have to get through, I have to do this. So you put a interest that will motivate you. That is the thing. So all these things will become secondary. Perseverance is very much important, very much needed. The passion and perseverance is very much needed to complete the dissertation, because within 24 months we have to finish. If we have finished DJO, 24 months. If you have state candidate, 3 years.
Yes.
Within 18 months, you have to finish. That should be your goal. Everything you should finish within 18 months. Select the topic, get an approval, start collecting the data, start analyzing side by side. Literature research is very, very important. If you do literature research only, you'll have a better idea. Then start writing your thesis also, side by side. Then to arrive at conclusion, it's no time. Then last 2 months, you have to have a conclusion. Nowadays, you people are giving it to statistician. So he takes 4 to 5 weeks, because all the PG will be going there to the same statistician. Medicine, surgery, ortho, everyone will be going. So all that you have to anticipate and handle it. That's it. If you have a passion, perseverance, and enjoy doing it, then it will become light.
Thank you, ma'am.
Thank you, madam.
Thank you so much.
Have a passion for thesis. We understood that point. Have a love for thesis, have a balance. Don't become Chandramukhi Jyotika, be that happy Jyotika. These are the take-home points that I can gather, and that balance which you will never forget. Your life, personal life, and the thesis along with the professional life balance. Thank you, madam. Excellent talk. Every slide we remember. Thank you, madam.
Thank you for the opportunity. The OGSSI, I think it should be useful for youngsters. Continue to persevere. Some study you must keep on. That will ignite some stimuli to you.
True, madam.
Thank you. All the best. I think this batch will do a wonderful dissertation. I think they'll enjoy doing it.
Yes.
Thank you so much.
Thank you so much, ma'am.
Geeta Lakshmi, madam, are you there, madam?
Oh.
She's joined late. Geeta Lakshmi, madam?
Dana da irukanga. Dana போட்டுருக்காங்க.
இருக்காங்க. Dana, madam, are you there, madam?
யூடியூப் போடல, போட்டோ போட்டாங்க தானா.
Priya, I am there. Priya.
Madam.
Geeta, madam. Please.
Geeta, madam, welcome, madam. So thank you for joining.
Yeah. I really thank Hepzibah madam for the wonderful presentation, and I think students, postgraduates would have really benefited. And thank you so much, madam, for being
you.
with us in OGSSI. Thank you so much.
Thank you.
Okay.
Thank you so much. Thank you. Bye.
Thank you, madam.
Thank you so much.
Thank you, Geeta ma'am.
Thank you.
Deepa.
Thank you, Deepa.
Thank you, Priya.
Bye.
Thank you, madam.
Bye.
Thank you, ma'am.
Thank you.
Okay. So thanks, Priya. Thank you, Sakiti, for the Shield platforms.
And end the meeting. Thank you, Sheil, for the platform, and thank you everyone who have
Nikita?
joined.
Yeah, I'm still with us. Some students are still
Yes.
with us. Okay.
Thank you.
Thank you, Nikita Otto. I think she's traveling like it.
She's traveling, madam, because she told me she's in the airport and she has a very poor network.
Okay.
Otherwise, like, she really does a very good job.
And you tell Priya the next upcoming webinar also every second Tuesday, 7 to 9.
Yes, madam. Yes, we will put it in the group as well. Every second Tuesday, we will have it. It will be followed by the quiz. We expect active participation from all our students. So thank you.